Hello to our favorite listeners and viewers. You are welcome. This is the Ordained Radio TV Gospel Ministry. I will bring you the end time news, the undiluted word of God, dynamic praise, trending health fact and gist, and talks on love, relationship, and marriage. You are back on Fit and Fabulous, the #1 health program showing on this station. I know it's been a while, and we are back. I am your host, Ajayi Adenike, and of course, we have a guest speaker on the show today. Because today we are bringing you a very important health topic that we need to discuss, and you also need to know. Debunk some facts about it and some myths about it. And know the fact actually behind what we are discussing today. So our guest speaker is no other person than Dr. Oladapo Adetunji, a pharmacist, a health practitioner, and a public health enthusiast. Welcome back on the show, sir.
Yeah, thank you. It's so nice to be back on the show. Welcome, viewers. Nice to have you joining us on board today. Thank you.
Thank you so much for creating time. So we know you have a very, very busy schedule, and we really appreciate you being here today. Thank you, sir. And so we'll get right into it. Please don't go anywhere. So today we'll be discussing something very important, like I said earlier. And what is that? We'll be talking about peptic ulcer. It's very common, and there are so many misconceptions about it, which we are going to clear today. So we'll be discussing what peptic ulcer is, the key causes of peptic ulcer, when and how do you know you have peptic ulcer, treatments and management, and also what are the general beliefs or the misconception we have about peptic ulcer. Don't go anywhere. So, sir, the stage is yours. So we'll be talking about what peptic ulcer is, so that our followers can
thank you so much. This topic is so of importance, nowadays, especially considering the fact that in our society, a lot of people have been complaining about ulcers, peptic ulcer, and all of that. I mean, those of us that will practice and will see patients, a lot of them, when we're counseling them, they talk about peptic. So what is actually peptic ulcer? It is an open sore, that occurs in the lining of the stomach. And that same open sore could also be found in the upper part of the small intestine. And that's why we classify peptic ulcer into duodenal ulcer or gastric ulcer. Gastric ulcer being the one occurring in the stomach. And then duodenal ulcer being the peptic ulcer occurring in the upper part of the small intestine. And it will surprise you if you look at the current prevalence of peptic ulcer. WHO says about 5 to 15% of the world population are down with that particular disease.
Wow.
While for us in Nigeria has been classified as the country that is on the 31st position in terms of death rates as a result of peptic ulcer. So that is just what peptic ulcer is about. We can't go into the nitty-gritty details because of the time. But that will give us a background of what we are talking about today.
Okay, thank you, sir. So what are actually the key causes of peptic ulcer? I think we would really like to know.
Now, we're still going to go into some misconceptions that people have about peptic ulcer. Okay. But basically, the cause of peptic ulcer could have been said to date back to about 1982, when a particular researcher, Dr. Marshall, decided to take some tissues containing, peptic ulcer. He drank it himself.
Wow.
And then, it was a research. The research won him a Nobel Prize in 2005.
Wow.
He drank it himself, be able to prove to people that, look, peptic ulcer has some organisms, involved in it. When he drank it, he became infected with peptic ulcer disease, and then he used a combo of antibiotics, and he was killed. So peptic ulcer is actually a result of two basic factors. Helicobacter pylori, which goes ahead to cause damages to the, mucosa of the stomach. Once the mucosa is eroded, the Helicobacter pylori goes ahead to do the work, and then you have sores. And also excessive use of a class of medication that we call non-steroidal anti-inflammatory drugs. To give an example, ibuprofen is the very common one among us, and aspirin. People take ibuprofen and aspirin and Felvin, which is a very common one.
Actually.
Anyhow, some people take it as if it's a routine paracetamol, it's a routine medication.
Especially drivers.
Yes. So most of the time, in fact, there's a study that pinpointed a lot of drivers, about 35% of them, out of a population of 611, that do out of station journeys from the southwest to the other parts of the country, 35% of them take at least 3 or 4 doses of ibuprofen on a daily basis. So you can imagine why we have an upsurge of peptic ulcer in recent times. So those are the 2 key causes of peptic ulcer: Helicobacter pylori, which is the organism, and then excessive use of non-steroidal anti-inflammatory drugs. Yes.
Wow, thank you so much, sir. So now, how do one know they have peptic ulcer? Like, oh, is it when my tummy is aching me, or maybe I need to eat on time? So how do one know they have peptic ulcer?
Yeah, so many schools of thoughts, but the 4 common ones is this: nausea and vomiting. Okay, it's one of the signs. Then when you eat little food and you're already feeling full, you are eating little food and you're already feeling full, that look, I can't finish this food. Even though on a normal basis, you should be able to consume that food and ask for more. Then when a person is belching a lot of time, when you belch, and then when a person feels bloated, those are symptoms and signs, of peptic ulcer. And then one other one is burning sensation or pains in the stomach. Yes, then it calls for attention. Yeah.
Wow. Thank you so much, sir. So it's actually not all stomach ache. We say stomach ache, and probably because they've not eaten and they're just tending to be ulcer and they're just having around trying to look for drugs and all of that.
No, it's not. There's something known as acid reflux, right? Okay. And acid reflux is as a result of the gastric acid in the stomach just moving upward into the esophagus, causing some stomach pains. It's different from peptic ulcer. Peptic ulcer is as a result of the removal of the mucosal lining, and then there's sore happening within the tissues that line the gastric line, either in the stomach or the upper portion of the small intestine. We talk about gastric ulcer and then duodenal ulcer.
Okay, so I think we would like to know how this can be treated. Is it actually curable? Because there was a time I was working at a pharmacy, and then there's this particular, he said he has been battling this ulcer for years. And I'm beginning to wonder, he has spent so much on drugs, on medication, I'm beginning to wonder, is this thing actually curable?
Yeah, it is, and just as I said, the causative organism is Helicobacter pylori. And that's why usually the physicians and, the health practitioners will tell you, go ahead and let's do H. pylori test.
Okay.
To rule out that, okay, it's not H. pylori that is causing this, and then they now look at the past medication history of that patient to find out how many of those non-steroidals he or she has been taking that could have led to the condition he or she is as at that time. So 2 pathways also based on the 2 factors that cause peptic ulcer. You want to eradicate Helicobacter pylori, and then you want to do a conformational change on the medication that the person is using. There are some people generally they may need to be on non-steroidals, but if you are going to place them on non-steroidals, then you need to introduce some other medications that will cushion the effect of eroding, or causing excessive secretion of gastric HCl, so that the issue of ulceration will not be part of it. So those are the 2 things: a combination of antibiotics to take care of Helicobacter pylori. There can be radical eradication of Helicobacter pylori, and there are so many combos that have been developed, that have been validated to work effectively in the treatment of this. So yes, it is curable.
Wow. Is it possible that after it has been cured, the person gets reinfected?
A lot of time we talk about lifestyle modification. I mean, if you are careless, if the person is careless with his or her lifestyle, there can be ulceration again. Yes, if you are careless with the lifestyle, there can be ulceration again. So a lot of things has to do with it. The kind of foods we eat, the sticking to whatever your physician says about your medication, the counsel that your pharmacist gives you when you are taking the medication, and all of that. Don't go outside this, and that's why we usually encourage people not to involve themselves in self-medication. Self-medication is actually not okay at all, because a lot of time, because of the kind of environment we have, people have access to medications. So just go ahead and you start buying this, you buy that. we've seen people using a combo of ibuprofen along with felzicam and then aspirin, saying, look, bricklayers do that they want to ensure that they're able to walk all through the day and all of that. Meanwhile, they are busy causing some other unwanted situations to their system.
Wow. Now, the general misconception that we have and what we all believe about peptic ulcer.
I'm just going to go through 5 of them quickly.
Okay,
so that we'll wrap up. Now, people usually say spicy food. In fact, one of our directors, as we were just coming in, said, I know spicy food, if I take a lot of spicy food, it's going to cause ulcer. Spicy food do not cause ulcer.
Okay.
Ulcer is as a result, just how we have said, the defect of Helicobacter pylori or excessive use of non-steroidals.
Okay.
What spicy foods you just do is a person that already has that infection, spicy foods will definitely aggravate it. Especially those ones that cause an upsurge in the production of gastric acid. Then some people believe when you drink milk, you're taking lots of milk. If you have peptic ulcer, it's going to heal it. It is just a misconception. While milk will just give a certain relief for some time, the calcium that is present in milk predisposes to increasing the acidity within the environment. So while you're having that relief, by the time the calcium begins to work, there's possibility of ulceration. Then some people believe that if you're involved in a high pressure job, that you're going to get infected with ulcer. All these are misconceptions. Then there's also this misconception that it's only elderly people that have ulcer. Or, well, if you have ulcer, just go ahead and take an antacid. By the time you take a lot of all this antacid, your ulcer will be cured. What the antacid just does is to just cover up that mucosal lining for that period of time. Once the effect wears off, then the ulcer pains are going to return. So those are misconceptions, and it still leads back to, 2 pointers. Make sure you eat the right diet. Make sure you do not do self-medication. Thank you very much.
Thank you so much, sir. We've heard a lot today. I've learned a lot. Now I know that peptic ulcer is caused by 2 major things. It's caused by H. pylori, which is the Helicobacter pylori, and then it's the organism, and it's also caused by
non-steroidal excessive use of non-steroidal anti-inflammatory medications,
like ibuprofen,
which is very common, aspirin, the usual felvin, your fexicam, piroxicam, and all of that.
Okay, so I think we'll just tell our listeners and viewers, when you have pain, you have headache or anything like that, the first line of action, don't just go and self-medicate like doctor just said. Don't self-medicate. Don't say, ibuprofen works. I think ibuprofen is stronger than paracetamol, and then you just go ahead to use ibuprofen or any of that. So I think that we should actually watch our lifestyle, watch our medication. Do not self-medicate. And if you notice any of the symptoms that have been mentioned earlier, it's not for you to now go ahead, or maybe because A used this and she was fine, and then you also go ahead to buy. No, you actually need to go through tests for H. pylori to know if it's actually the causative agent or if it's as a result of your history of medication use. So it is very, very important. Peptic ulcer can also be cured based on medications that you'll be given by your health practitioner. So I'm sure that we've learned a lot today. Thank you so much for staying with us. Please don't forget to invite your friends and family to follow us. We'll bring in a lot of health topics that we'll be discussing, and also follow us on our social media platform on Facebook, on YouTube, and on Instagram at Odin Radio TV. Till we meet again next time, I am your host, Ajayi Adinike. Stay safe, stay healthy. Bye.
Bye for now. Thank you.